Hello everyone, welcome back to Mandi House Heart of Care YouTube channel. We are bringing a new series of educational videos to the health and social care. These educational videos are not very long videos, so you don't need to worry about spending your valuable time. It will be maximum 3 to 5 minutes long, and you can actually use this video for your job purpose. In this series, we are trying to give some light into the care home equipments and care home functional and health and safety, infection control, and so many things, how it works in a care home. Because most of the care home staff nowadays, or thousands of staff in care homes and hospitals, coming from abroad, different countries, and they never heard about such equipments or some of the system works in a care home. So we just wanted to introduce you, the newcomers and the existing staff as well. What is this, all these equipments? What is it called and how it works, and how it help and support the residents or patients or service users who you work in, whatever the sector you work. It may be a residential home or a nursing home or in a domiciliary care or in hospital. You should know what the equipments are for and what is it called and how to use it safely and appropriately, so you will be safe as well when you completing a task. And in each episode we are trying to bring one specific subject, and then we will go through the various equipments we use for that subject, and what kind of help and support you get, what kind of policies and procedures within your company or system works for it, and what kind of training and development you may need it to operate it, and what kind of experience you will get from it. It is all about health and safety of the people who you work with and then who you are working for as well. And you have to follow your own company or your own employer's policies and procedures. Many things in the care home, especially the facilities in the care home, the equipments they're supposed to use to transfer people. Moving and handling is very important. You should know what equipment you are actually using, and then what kind of equipment. Is it right equipment? Is it the right size of sling you are using? Or other facilities such as fire alarm system, bed, profile beds, mattresses, call bells, sluice machine, clinical bins, clinical waste bins, what color of bins we use and what purpose, what color of clinical waste bags we use, yellow, red or clear bags or black bags, and how often they come and collect it, and when you're coming into food hygiene, you look into the kitchen, is it clean? How often you clean your kitchen, what kind of documentation you maintain, fridges and freezers inside the kitchen, how often you record the temperature of fridge and freezers, what is the maximum temperature and minimum temperature of fridge and freezers, and the food temperature, etc. We have profile beds which have ultra low profile bed, medium profile bed, and the profile bed with the side rails, without side rails. Why we using that a bed side rail, what kind of protection on bed rails, and also what kind of chairs we use. We use normal chair, reclining chairs, and comfortable chairs. Why we using that kind of chair? Mattress wise, where people lying or resting in the care home, there are different kind of mattress, that is Pro-Part mattress, high-vis mattress and airflow mattress, and what kind of settings for this airflow mattress to support their skin integrity, which will we show as well. To prevent falls or protect people from falling, we use sensor mat, which is on the floor sensor mat. There may be another thing is chair sensor mat or bed sensor mat, and then even we use ultraviolet beams as well if it feasible to use it. Calling emergency bell is very important. Also, in the event of an emergency, how do you press the emergency bell? How do you get the people to come and check the person? You may be attending in so many trainings in different moving and handling or nutrition or medication, but in practically we are going to show you how these things works. What is this equipment, and then what is it called for, and what is it used for? So which is what we're going to do. So for example, if somebody coming from another country, they may not heard about what is gravy or what is fish and chips or what is cereals and porridge. Some of the elderly residents may say in their own way, I want to spend a penny. What is the meaning of spend a penny? It is, I want to use the toilet. But how many of us know, before we actually knew about it, what is spend a penny? The word is break a leg, which is we wish you good luck. So things like that, so many things we're going to explain in this video. So these kind of some of the things we want to explain to you so you can learn. This is only an informative video. We will explain everything in our upcoming videos. If you share our videos to your friends and people who work in care homes and hospitals to learn more about it, you please comment on our video comment session so we can come back to you if you have any doubts, any clarification, anything you needed. These videos are only for educational purpose, and it's mainly for the new staff who are entering into care sector, hospital, health and social care. Do not replace your formal training or your company policies and procedures. Thank you for watching this video. We will see you on our first episode on this series of care home education video.